Hi and welcome back to another video of Medic Notes. This video will be on heart failure. Heart failure is a clinical syndrome. It can be due to structural or physiological abnormality of the heart, which results in the heart to be unable to meet the metabolic demands of the body, or it can only do so by increasing the filling pressures of the heart. Heart failure can be classified into many categories. The first type of classification is to classify into acute and chronic heart failure. So acute heart failure usually means new onset of acute decompensation of the heart failure, characterized by pulmonary and or peripheral edema where there is swelling of the limbs, with or without signs of peripheral hypoperfusion. Whereas chronic heart failure, it develops or progresses slowly. So acute heart failure, it can be due to decompensation of chronic heart failure, where there is sudden onset of symptoms. Second classification is low output and high output heart failure. So the causes are different for these two. The causes of low output heart failure can be due to excessive preload, such as mitral regurgitation or fluid overload, pump failure, such as systolic or diastolic heart failure, and chronic excessive afterload, like aortic stenosis or hypertension. Whereas for high output heart failure, this is rare and it can occur in anemic patients, pregnancy, or hyperthyroidism. The third classification is systolic or diastolic failure. In systolic failure, the ventricles are unable to contract normally, causing reduce in cardiac output, and the ejection fraction is less than 40%. Whereas for diastolic failure, it is due to the inability of the ventricle to relax and fill normally, causing increase in filling pressures. In diastolic failure, the ejection fraction is preserved, where it is more than 50%. So this is also known as heart failure with preserved ejection fraction, HFpEF. Another classification is the left and right ventricular failure. So the symptoms for this will be different depending on the side where the heart is unable to pump enough blood, either left side or right side. So later I will talk more about the symptoms. So if in the setting of left ventricular myocardial dysfunction, the ejection fraction can also be classified into three groups, which are reduced, preserved, or mid-range ejection fraction. So for reduced ejection fraction, it will be 40% or less. Mid-range will be 41 to 49%, whereas preserved ejection fraction would be 50% and more. Moving on to the symptoms to differentiate between left heart failure or right heart failure. For left heart failure, left ventricular failure, the blood is unable to be pumped out to the whole body. So the blood will accumulate in the lungs, and the symptoms normally present with dyspnea, poor exercise tolerance, fatigue, autopnea, where in history taking we have to ask the patient at night how many pillows do they need to put under their head to sleep. And most oftenly they will say at least 2 pillows, or else there will be shortness of breath. And also paroxysmal nocturnal dyspnea, nocturnal cough, and also wheezing. These are the symptoms of left heart failure. Whereas for right heart failure, the defect is in the right ventricles, so the blood will accumulate in the whole body, where the patient will present with peripheral edema, such as limb swelling, and also facial swelling, and sometimes there might be abdominal distension, which is ascites. The signs of heart failure include cyanosis, hypotension, narrow pulse pressure, and if there is left ventricular dilatation, there will be displaced apex beat. If there is pulmonary hypertension, there will be right ventricular heave. And we should also look out for signs of valve diseases by auscultating for the presence of any heart murmur. For investigations of heart failure, we can do ECG, which is electrocardiogram, to look out for evidence of ischemia, myocardial infarction, or even ventricular hypertrophy. This is to look for the cause of the heart failure. We can also do chest X-ray, where there are 5 typical findings of heart failure. known as ABCDE. Shown in this picture over here, A is alveolar edema, B is curly B lines, C cardiomegaly, D is dilated prominent upper lobe vessels, and E is pleural effusion. These are the classic signs, chest X-ray signs for heart failure. B natriuretic peptide expected to be high, which is a significant finding to confirm heart failure as well. Echocardiogram is the key investigation. It can be used to look for the cause, to look for any myocardial infarction or valvular defects, and it can also confirm the presence or absence of left ventricular dysfunction. Cardiac biomarkers can also be done to check whether there is any myocardial infarction. So this slide shows the chest X-ray of a heart failure characterized by the ABCDE. Heart failure can be classified using the NYHA classification. So it is divided into 4 stages. Class 1 is the patient has heart disease, but there is no dyspnea during ordinary activity. Class 2, there is dyspnea during ordinary activities. Class 3, there is dyspnea during less than ordinary activities. And Class 4, dyspnea is present at rest. For management of heart failure, we have to treat the underlying cause, and we can treat exacerbating factors if there is any, such as anemia, hyperthyroidism, or infection that will require different treatment. Avoid exacerbating factors such as medications like NSAIDs, which will cause fluid retention, and also verapamil, which is a negative inotrope. Some of the drugs that are included in the management of heart failure include diuretics, like loop diuretics, furosemide, and it improves the symptoms, but studies show that it doesn't really help in reducing the mortality rate. Second is ACE inhibitor, which is considered in those patients with left ventricular systolic dysfunction. It improves symptoms and also prolongs the life. Beta blocker, such as carvedilol, can help to reduce mortality in heart failure. Mineralocorticoid receptor blockers, such as spironolactone, can reduce mortality as well. Digoxin can sometimes be used in some patients. So that's all for this video. Thank you.